Welcome, everyone. My name is Katie Guglielmo from Frier, Levitt. Thank you for joining us for today's webinar, Demystifying CBD, what you need to know about the growing cannabidiol market. Today's presenter will be Lanton, and I'd like to mention that all lines have been muted. Also, I want to remind you about the questions tab on the right side of your screen. Go ahead and type in your questions throughout the webinar today. We'll wait until the end of the presentation to answer those, but we'll be sure to get to all of them, whether it's during the webinar or after today's presentation via email. We'll be providing you a link of the webinar recording early next week. And let's get started. Ron, take it away.
Well, thank you so much, and thank you to everyone else that's joined us today, actually this afternoon, talking about, again, demystifying CBD, what you need to know about the growing cannabidiol market. So let me tell you a little bit about Frier Levitt Government Affairs. Frier Levitt Government Affairs is a full-service bipartisan government affairs, lobbying, and strategic consulting firm providing advocacy exclusively for the life science and healthcare sectors. We work with providers, healthcare associations and alliances, manufacturers and wholesalers, providing information and guidance on navigating governmental and political developments, and assist them in building working relationships with legislators and regulators. So while I have the bio here, I wanted to just go over a quick couple of housekeeping items, and you guys can keep reading if you choose. First, just want to know, for those that have not been on a webinar with me, whenever I mention Congress or the administration, I keep everything in a neutral viewpoint. I don't want any bias here because I just want everyone to focus strictly on the information. Second, Katie was nice enough to talk about how this presentation will be available for playback, should be no later than early next week at the latest. So what I want you to do is just kind of sit back. If you want to take notes, great, but just know that this is going to come back later. So if you do miss something or if you're looking for slides, that will happen at a later point. So you will get a chance for that. Also, too, she did mention that I would be happy to handle questions in the end. If there's something that I don't know, what we'll do is we'll just simply take it offline and we'll make sure to get back to you with your questions. And I know that that might be a possibility during this webinar, because as you'll see when I actually go into the information, there's a lot of different contrasting information out there, contrasting laws, I mean, even between states about what's what. So it is very confusing, but we will try to help you get through all of that. Also, sourcing for this webinar has been very interesting. You know, the government, as far as something official when it comes to CBD or marijuana or things like that, they don't have a lot of official information out there. So we've had to go to a variety of different sources, from things like CNBC, CBD Oil Review, different things like that, Business Insider, along with some other additional original research. So I just wanted to let you know about that as well. And I think that is all of my housekeeping items. So with that in mind, let me go ahead and move to our disclaimer. And the reason I have to give this to you is that, yes, I am Executive Director of Frier Levitt Government Affairs, which strictly deals with policy, but at the same time, I do hold another job title, which is Senior Counsel for Frier Levitt Law. And because of that, we have to do a disclaimer. So bear with me, and then we'll get into the meat and potatoes of this actual webinar, which you guys are here for. The materials and information provided in this presentation are for informational purposes only and not for the purpose of providing legal advice. The information contained in this presentation is a brief overview and should not be construed as legal advice or exhaustive coverage of the topics. You should contact your attorney to obtain advice with respect to any particular issue or problem. Statements, opinions, and descriptions contained herein are based on general experience of Frier Levitt attorneys practicing in pharmacy law and are not meant to be relied upon by anyone. Use of and access to this presentation or any other materials or information contained within this presentation do not create an attorney-client relationship between Frier Levitt or any of its attorneys and the user or viewer. So I don't want that to scare you guys off. If you guys have questions, let me know, especially if it's policy related. If it's something that's legal or something that you really don't want a lot of people to know about, just type the question in, or you can either contact me after the webinar and I can get to you and we can have a confidential conversation. So with that in mind, let's actually get into the good stuff, the actual reason you came here to talk about CBD and actually what's going on. So let's talk about the presentation objectives today. And I know that there are a lot of technical words in this presentation because like, bam, here we are with the first one. So I do want to tell you, I'm not a clinician. I'm going to be doing my very best to make sure that I get the pronunciations correct. Cannabidiol products have seemingly flooded the markets, suddenly springing up in many places. This has led pharmacies, natural health food stores, and other retailers to discuss new strategies to position themselves in the developing market of CBD. However, recent market saturation and uncertain regulatory oversight have caused massive confusion over whether these products are legal or not. This webinar will explore several issues around CBD, including CBD versus THC, an examination of current state and federal CBD and marijuana policies, a discussion of current administration viewpoints, including the FDA, the Food Drug Administration, as well as the DEA, and other related business trends. So before we get started, let me tell you about why you're looking at this particular picture. This is just an illustration of just how far and how fast we've come with the CBD market. And, you know, just not necessarily how out of control it is, but just when you have almost zero regulation as far as there's really no regulatory scheme at all. You know, no one knows if it's FDA, if it's FTC, is it DEA that you go to that's like the sole regulator. Sometimes when things like this happen, you remember Bitcoin, it was everywhere. So this is an example. This is a picture of a Carl's Jr. burger. It actually appeared in an article on April 17th on CNBC. And they were talking about how Carl's Jr. is going to be testing a CBD-infused burger at one of its Denver locations for one day only. And it's on April the 20th, and that's the unofficial holiday for cannabis enthusiasts. And they said that this limited time offer, they're going to have a few things. First of all, this cheeseburger delight is going to feature 2 beef patties, pickled jalapenos, pepper jack cheese, waffle fries, and about 5 milligrams of hemp-derived CBD extract in the burger chain Santa Fe sauce. So again, not trying to make anyone hungry, but I just wanted to make the illustration that, you know, CBD, everyone's trying to get in it. And right now there's really no regulation, at least to this point, just of yet. So again, just another illustration of what's going on. And if anybody is wondering, yes, this is at odds with the FDA because when it comes to CBD and food, they don't want that right now. And we will talk about that as we get into the presentation. So let's talk about some relevant terms. What is CBD? Well, cannabidiol or CBD is a non-intoxicating cannabis derivative. It's becoming a booming multi-million-dollar business that's getting mixed into everything from beans, as far as jelly beans, to coffee, pet products, to pain relievers. Now, THC and CBD are 2 primary cannabinoids that are occurring naturally in a cannabis sativa plant, most commonly known as cannabis. Both of these substances interact with the cannabinoid receptors found in the human body and brain, but they differ dramatically in their effects. CBD, non-psychoactive, which means that it will not get the user high. And because of this, CBD appears a lot more frequently than THC in dietary and natural supplements. Now, THC is a psychoactive component in the cannabis plant that creates the high that we know from recreational use. THC works by mimicking the effects of 2 natural neurotransmitters that we naturally produce that modulate sleeping and eating habits, pain, and other bodily functions. Now, the effect of THC includes relaxation, reduced aggression, altered sights of smell, hearing, sight, fatigue, and hunger. Now, according to the National Institute of Drug Abuse, otherwise known as NIDA, THC affects things like thinking, memory, pleasure, movements, concentration, coordination, sensory, and time perception. For these reasons, doing things like operating heavy machinery or driving under the influence of the drug may be dangerous. Now, according to a CNBC report, THC has a chemical formula of C21, H30, and O2, with a molecular mass of 314.464 grams. but it's very similar in structure and molecular mass to its counterpart of CBD, which actually dilutes the effects of THC. Now, among dozens, THC can be used in syrups, oils, edibles, drops in medicines, topicals, including lotions, balms that are used for anti-inflammation. So what about CBD? Well, CBD actually exists in agricultural hemp and medical cannabis. While cannabidioids are present in several plants, cannabis is the only plant known to contain CBD. CBD has the same chemical formula as THC, but the atoms are arranged differently, so it makes it so that CBD doesn't have that same psychoactive effect that THC actually has. So what we're seeing right now in the market is a back and forth between both CBD and THC. So THC is an illegal drug with a considerable immediate and long-term cognitive side effects with chronic use resulting in significant abnormalities in the heart and the brain. While CBD, on the other hand, lacks the harmful cognitive effects of THC and can counteract those psychoactive effects of THC. Cannabis plants containing small amounts of CBD and high levels of THC result in that stronger stoned feeling. And then CBD, you have less of THC, which creates a more weaker, relaxed effect. Given the increasing popularity of medical cannabis, breeders are currently creating strains with higher CBD to THC ratios to minimize the psychoactive side effects. Overall, the lower health effects of CBD combined with its efficiency make it the more preferred ingredient over THC itself. So cannabis, hemp, marijuana, these things are not the same. Cannabis is from a family of plants with two primary classifications, indica and sativa. While marijuana can be considered a member of either family, hemp is a member of the cannabis sativa family. Marijuana features broad leaves, dense buds, has a short bushy appearance. In stark contrast, hemp features skinny leaves that are concentrated more towards the top of the plant, grows taller and skinnier than marijuana, with a few branch under its upper portion. Cannabis contains a variety of different compounds. We talked about those a little bit, THC and CBD. And then again, when comparing hemp to marijuana, there's a huge distinction. While hemp contains a very low concentration of THC, which is 0.3 or less, marijuana is abundant with THC with concentrations between 15% to 40%. Because of this, hemp is grown primarily for industrial purposes, while marijuana is grown for recreational and medicinal purposes. Because marijuana is abundant in THC, it is naturally grown for its psychoactive properties, again, because it could be either recreational or medicinal. Marijuana could be smoked, inhaled, ingested, or injected directly into the body. And then THC, often commonly extracted from the plant, used in a variety of methods, including vaporizers, capsules, edibles, or more. Hemp, on the other hand, is used for industrial purposes like paper, clothes, building materials, blankets, biofuel, food products, oils, and more. And with this fast-growing popularity of CBD across the globe, hemp is also used to create a wide variety of THC-free CBD products. In most of the United States, the allowed THC content for hemp cannot be more than 0.3%, while it's 0.2% worldwide. For decades, federal law did not differentiate hemp from other cannabis plants, all of which were made effectively illegal in 1937 under the Marijuana Tax Act and formally made illegal in 1970 under the Controlled Substances Act. The latter banned cannabis of any kind. So now that we have a little bit of a background on what some of these terms are, cannabis, hemp, marijuana, THC, CBD, let's take a look at a couple of graphs here. First, you can just see a little bit about the different species between marijuana and hemp, the names, the psychoactive content, its uses, and then estimated domestic market value, just to get a picture of what it is. Our next graph here talks about hemp oil versus cannabis oil, and you can see the difference between the two. You go by product, tells you the difference between the two. Labeling must state that it's made from hemp. Then on the cannabis side, it has to show a ratio of CBD and a manufacturing date and a batch number. We have different testing protocols. Due to lax testing outside the United States, products may be highly contaminated. And then over on cannabis oil, it's tested for consistency. For hemp, GMOs, trans fats, and additives. The ingredients over in cannabis, no corn syrup, GMOs, trans fats, or additives. You see the different extractions, BHO, propane, hexane, and hydrocarbons, and then cannabis non-toxic, supercritical CO2. And then hemp, typically low in cannabidioid content. A huge amount of hemp is required to extract a small amount of CBD, raising the risk of contaminants because hemp draws toxins from the soil. And then lastly, the robust profile of the whole plant of cannabis enhances the therapeutic benefits of CBD and THC itself. So what's some of the legislative initiatives that are going on right now when it comes to this type of product? Well, in 1996, California voters passed Proposition 215, making California the first in the union to allow for medical use of marijuana. Since then, 33 more states, including DC, Guam, Puerto Rico, and the Virgin Islands, have enacted similar laws. As of January 22nd, 2018, the Vermont legislature passed adult use legalization legislation, and the governor did sign the bill. The measure does not set up a regulatory system for sales or production, so we'll have to see exactly how that's going to play out. A total of 34 states, including DC, Guam, Puerto Rico, and the U.S. Virgin Islands, have approved a comprehensive, publicly available medical marijuana/cannabis program. Approved efforts in 12 states allow use of low THC, high CBD products for medical reasons in limited situations or as a legal defense. And again, state laws. So there's this soup of state laws that's happened with CBD and marijuana use. We talked about our number. We have 34. And the federal government is not the only government official that's actually grappling with the use of CBD. New York City health officials have also ordered restaurants not to sell CBD-infused products. Meanwhile, Louisiana officials have recently said that for the time being, they will give citations for retailers that are selling CBD products. And at the same time, we have this contrasting Maine law that will allow CBD inclusion in food. So it really comes down to what jurisdiction are you in? What state are you in? And even if it's state, it comes down to locality. Sometimes what is your city allowing you to do? So there's just a hodgepodge of different things that are going on with this particular issue. And to illustrate this a little bit further, I wanted to show you guys just a map of the different marijuana policies that are happening across the country. You can see here from the map, I did mention the Vermont adult use law that was signed January 22nd. You'll see that at the very bottom. But if you look at the chart here, it talks about the adult medical use regulated program, and you'll see that in the very dark. You'll see with the stripes, and I believe that's only an island that's doing that right now, or I'm sorry, a territory. Adult use only with no medical regulated program. Comprehensive medical marijuana program, you'll see the respective states for that. Respective states for CBD low THC programs, and then states that have no public marijuana access program at all. So just to give you a snapshot of where you are, and if you're actually thinking about getting into this business, what types of laws you have to look at, this just gives you a quick example. So the one thing I did want to talk about, because it's on everyone's mind when we come to CBD, is the actual farm bill, because this is where a lot of the CBD just kind of took off, and that's why we saw things like we did earlier with the Carl's Jr. burger. So the 2018 Farm Bill, otherwise known as the Agricultural Improvement Act of 2018, was reauthorized many expenditures in the prior United States Farm Bill from the Agricultural Act of 2014. It was $867 billion. It was a reconciled farm bill. It was passed by the Senate on December 11th of 2018, and then by the House on December 12th. And on December 20th of last year, it received the president's signature and became enacted into law. Now, for purposes of our discussion, the Farm Bill demonstrated that hemp was no longer deemed an illegal substance. But the bill said that the FDA still had the power to regulate cannabis and its derivatives, as any products claiming CBD therapeutic benefits needed FDA approval for their intended use before going to market. The bill does say that hemp has to have tetrahydrocannabidiol, or THC, concentration of not more than 0.3%. Hemp can now be cultivated broadly, as hemp-derived products can now be transported across state lines for commercial purposes. I do want to just put a little asterisk there that some states have some different requirements for what you can ship in and ship out of the state when it comes to hemp. So that is something I do want to make everyone aware of as well. Second, the Farm Bill stated that there will be significant shared state-federal regulatory power over hemp cultivation and production. The state departments of agriculture must consult with the state's governor and chief law enforcement officer to devise a plan that must be submitted to the Secretary of the USDA. A state's plan to license and regulate hemp can only start when the Secretary of USDA approves that particular state's plan. Now, for states opting not to devise a hemp regulatory program, the USDA will construct a regulatory program under which hemp cultivators in those states must apply for licenses and comply with a federally run program. So what about the Department of Agriculture? Specifically, the Agriculture Marketing Service, also known as AMS. So AMS is going to be the guys that are going to be overseeing this effort here. And I just wanted to kind of make you aware of this because not only are we talking about FDA, FTC, DEA, but now you have these guys to think about. And right now, there's really no clear form of who is the primary regulatory overseer. It's kind of like digital health because there's like 3 agencies that regulate that. So this is just a product of things being very early in time, policy still being developed. And, you know, for you guys that actually want to get into this business, these are people that you have to keep your eyes on. So let's get back to AMS for the time being. On February 27th of this year, the USDA issued a notice to trade stating that the USDA had started gathering information to undertake a rulemaking to implement this particular program. Regulations are expected to be issued by this coming fall to accommodate the 2020 planting season. Now, last month, the AMS, again, the Agriculture Marketing Service, held a webinar to accept public comments. There were a couple of questions that were raised during this webinar. Some were, post-harvest testing standards for THC should be uniform. Some webinar participants noticed that stress factors can cause THC levels in plants to increase, and they urged the USDA to factor this into testing requirements. They also called for common standards for THC testing labs to ensure that testing methods and protocols don't vary across states or laboratories. And that's one thing that I've been hearing from retailers that have asked me questions offline about this. They're saying, well, you know, we want to make sure that we can get some kind of uniform testing. And I'll say, well, it really depends on the lab, because sometimes if you have the same crop that's come out and you've sent it over to the lab, you may get different results. And that may be because some internal process that they have. So you want to make sure you understand if you're doing any business with the lab or trying to figure all that stuff out, what are their particular protocols to make sure that you get close to a uniform test every time. Also, the need to educate the financial sector in order to access banking institutions was also conveyed. It was explained that some banks fear extending loans to hemp producers for liability reasons and for misconceptions about the particular plan. Now, while AMS is determined to finish drafting the hemp rule no later than November 2019, there were other concerns raised on how this quick time frame could impact the industry's ability to address some of the issues that were raised. Another question describes the state and we find ourselves in as far as how oversight goes, as to how AMS was resolving a number of issues before there could be an adequate interstate commerce system, as well as a stable, defined regulatory enforcement body. So that's exactly what I was talking about earlier. There's like 4 guys now, right, that are overseeing this. And until this policy starts to take some kind of uniform, cohesive effect, you have to watch all 4 of these agencies. Again, FTC, FDA, DEA, and the USDA. And it really depends on what you're trying to do with your particular business model, what you're selling, and who your partners are in the supply chain itself. So let's look at the FDA. So the FDA has approved the first drug comprised of an active ingredient derived from marijuana to treat rare and severe forms of epilepsy. This happened on June 25th of 2018. The FDA approved Epidiolex. It's from CBD oral solution for the treatment of seizures associated with 2 rare forms of severe epilepsy. Now, this is the first drug that's FDA approved that contains a purified drug substance derived from marijuana. It's also the first time that the FDA has approved the drug to treat patients with this type of form of epilepsy. So Commissioner Gottlieb, and I know that he's no longer the commissioner, but I just wanted to at least bring up a quote that he had about this particular drug so we can try to get some kind of insight as to how FDA is thinking. And that's even more important now because Commissioner Gottlieb is gone, and he was not only was he moving into generics and biosimilars, but he was also trying to get some regulatory boundaries around vaping and around CBD itself. So this is what he said about the approval. This approval serves as a reminder that advancing sound development programs that properly evaluate active ingredients contained in marijuana can lead to important medical therapies. Controlled clinical trials tested the safety and efficacy of the drug, along with careful review through the FDA's drug approval process, is the most appropriate way to bring marijuana-derived treatments to patients. So now that we know that the FDA has made progress with approving a drug derived from marijuana, how does the FDA feel about CBD products in general? Well, in order to know this, we need insight into FDA's next steps on creating a framework for the lawful marketing of appropriate cannabis and cannabis-derived products under our existing authorities. Now, according to the FDA's recent announcement on this issue, these new steps include a public hearing on May 31st, that's coming up in just over a month from now, as well as a broader opportunity for written public comment for stakeholders to share their experiences and challenges with CBD products, including information and views related to public safety. Right before, and before I go on into some of the other bullet points, right before Mr. Gottlieb left, he was talking about, okay, when I have this hearing on May 31st, I see this big booming unregulated field right now of CBD, and there's everyone's going off in different directions. Remember, again, slide 6 with the Carl's Jr. burger. So we need to get our hands around this to make sure that people are safe. What people are taking is actually what they're taking, and we want to make sure that nothing's adulterated. So we need to have this hearing. So this is very important for you guys to either engage, at this particular public hearing. You can send comments in to talk about what your particular business model is with these products, or some of the problems that you're seeing, because now is the time to start talking about this. Also, the formation of a high-level internal agency working group to explore potential pathways for dietary supplements and/or conventional foods containing CBD to be lawfully marketed, including a consideration of what statutory or regulatory changes might be needed and what the impact of such marketing would be on public health. Right now, they don't want you to put anything with CBD and food together, so they're saying, at least at this hearing, we're going to take a look at it, see what you guys are looking at in the marketplace, and then what kind of problems you guys are coming up with. Also, during this hearing, there's going to be updates to the FDA's webpage with answers to frequently asked questions on this topic to help members of the public understand how the FDA's requirements apply to these particular products. Also, the issuance of multiple warning letters to companies marketing CBD products with egregious and unfounded claims that are aimed at vulnerable populations. And one of the most recent examples that the FDA has done, which was really unique, because not only did the FDA send a warning letter to these particular companies that I'm about to talk about, but they teamed up with the Federal Trade Commission, the FTC, which is really different. They don't really team up with the FTC too many times. So when they do team up with the FTC, again, you want to pay attention to it. So what this particular warning letter did was they announced that they issued a couple of joint warning letters against 3 companies: Advanced Spine and Pain, NutriPure, and Pot Network Holdings. The reason they did that was in response to their making unsubstantiated claims related to their product's ability to limit, treat, or cure cancer, neurodegenerative conditions, autoimmune diseases, opiate use disorder, and other serious diseases without sufficient evidence and the legally required FDA approval. That's the reason why the FTC came in, because if you're actually making promises to consumers and they're not followed through, you're going to get FTC oversight, which is, again, another reason why you don't want to overlook the FTC on this particular issue. Now, there have been instances where people have taken CBD and they've gotten better. We've seen pain creams, we've seen patient testimonials, these things work. But there's not really been anything that's been official from any of these regulatory overseers that said, yes, this stuff works. What we continue to see, and what I expect to continue to see even with this hearing that's coming up next month, is that we need more studies. We need more evidence that this stuff is good, and then we're going to make sure that it gets more out into the market. But I understand when things are early and people want to jump in and kind of take that market share, Yes, it's a good idea to have as long as you make sure you understand the regulations that are around you and to make sure that your business model is clean because, at the same time, there's too many things that could go wrong without the proper help. So let's take a look at how the FDA is going to regulate CBD after what we've just talked about with this May 31st hearing. So how do I think, the FDA is going to take a position on this? Well, at this time, I think it's hard to tell. And we're definitely going to have more insight, not only into the FDA's thinking as a whole during next month's public hearing, but we'll also have to have some additional insight into the acting FDA commissioners, Ned Sharpless, he just pretty much got the job earlier this month, into Mr. Sharpless's thinking on the issue and whether he will differ from former Commissioner Gottlieb's aggressive approach in trying to regulate this. But what about those edible CBD foods? Because again, I keep getting asked questions about it, and I just want to drive the point home about where we are today with this, okay? Unfortunately, the FDA has indicated that CBD cannot be sold as a dietary supplement, nor is it legal at this time to sell food in which CBD has been added. Edible products infused with hemp oil versus products infused with pure CBD is where we are today. This is the key distinction about what kind of products can actually be sold right now. And it's prohibited to introduce or deliver for introduction into interstate commerce any food to which CBD has been added because they contend that CBD is a drug, they being the FDA. Hemp oil containing naturally occurring CBD is not a drug. So I just want to make sure that I drive that point home. Now, one thing is for certain about this. While the FDA is relying on scientific evidence surrounding this type of product, the DEA continues to take a stringent and oftentimes contrasting stance on how it believes CBD should be regulated. Now, the DEA has repeatedly insisted that any CBD product other than a pharmaceutical drug, Epidiolex, remains a Schedule I controlled substance. So technically, they still can't get you for this, although the DEA has been saying, while we can, we're not likely to do it because we're really focused on larger operations of illegal marijuana products. So in 2018, the DEA said, quote, DEA will continue to support sound and scientific research that promotes legitimate therapeutic uses for FDA-approved constituent components of cannabis, consistent with federal law, said the acting administrator of the DEA. Now, the DEA is committed to continuing to work with our federal partners to seek ways to make the process for research more efficient and effective. However, the DEA believes that it only reschedules CBD drugs that have been approved by the FDA and that contain no more than 0.1% of THC, and for now, that's just Epidiolex. Now, at the same time, we just saw the FDA said 0.3% was okay, where these guys are saying 0.1. So they really don't want you to do it. They've kind of put these barriers up here to where they're trying to discourage, but at the same time, we have a market, we have state laws, and when you have just kind of a movement, a wave of different state laws that are kind of pointing people in the same direction, we start to get more acceptance and less resistance from Congress, and then you may start to see the DEA move only if Congress instructs. Now, when it comes to overseeing CBD, again, the DEA has been known to struggle with itself on how to regulate the products. And I will quote you this just so you can understand where they're coming from. Now, the DEA said, because recent public inquiries that DEA has received following the publication of the final rule suggest there may be some misunderstanding about the source of CBD in the cannabis plant. And we also note that the following botanical considerations. As scientific literature indicates, THC, cannabinoids, and CBD are found in the parts of the cannabis plant that fall within the Controlled Substance Act's definition of marijuana, such as flowering tops, resin, and leaves. According to scientific literature, they are not found in parts of the cannabis plant that are excluded from the CSA or Controlled Substance Act definition of marijuana, except for trace amounts, typically only parts per million, that may be found where small quantities of resin adhere to the surface of seeds and mature stalk. Thus, based on scientific nature and literature, it is not practical to produce extracts that contain more than trace amounts of cannabidioids using only the parts of the cannabis plant that are excluded from the CSA definition of marijuana, such as oil from the seeds. And lastly, the industrial process used to clean cannabis seeds and produce seed oil would likely further diminish any trace amounts of cannabidioids that end up in the finished product. However, as indicated above, according to the DEA again, if a product such as oil from cannabis seeds consisted solely of parts of the cannabis plant excluded from the CSA definition of marijuana, such product would not be included in the new drug code or in the drug code for marijuana, even if it did contain a trace amount of cannabidioids. So we see this dilemma right now. The DEA only has the authority over drugs, whereas the FDA has authority over the food and drugs. So we see CBD oil is not classified as a drug, which leaves us with the FDA oversight. And again, we've got these quotes from DEA where they're kind of going back and forth over themselves saying, yes, we saw what the FDA did. Yes, we see what the marketplace says. Yes, it's confusing. We are contradicting ourselves. We only want 0.1. And then we're going to go into this, what we think should be or shouldn't be. So it's really a moving target with DEA. And I think they keep that because, again, their nature is not to want to approve these things, but at the same time, they can't fight what's changing in the market, and they're having a slow time accepting that. So I just wanted you to see just the contrasting and confusing, very much confusing times that the DEA has come out and said something directly on CBD. So now that we understand the policy behind CBD and some of these really contrasting state policies and even localities for that matter, and what some of the terms are so we can kind of get our hands around that, let's take a quick look at the marketplace of what's happening. So with the FDA approval of Epidiolex, by GW Pharmaceuticals, the floodgates have seemed to open for cannabis-based medications. Organigram and also Canopy Growth Corporation. These are interesting options. You can see these for investing options in either the production or research sides of marijuana. And also the legal marijuana cultivator, processor, and distributor Tilray. They've been on the news quite a lot when it comes to this particular field. Recently went public on the NASDAQ Global Select Market. Last year, retail sales of CBD consumer products in the United States were estimated, according to Cowen, between $600 million and $2 billion. And Cowen is an investment research firm. Now, Cowen conservatively forecasts that these sales are going to reach about $16 billion by 2025, with health and wellness products leading the way, and food, beverage, beauty, and vapor to also play a role in this marketplace. But what about the actual product itself? Well, farmers, when they're gathering the stuff, don't exactly know how much THC their plants produce until they're harvested, dried, and the CBD is actually extracted. At this time, there really aren't any federal laws requiring companies to test CBD, whether it goes into beauty or food products. What's even more disturbing is that those lab tests that I talked about earlier in this webinar can be inconsistent, with CBD stores now scrutinizing suppliers on how hemp is grown, how CBD is extracted, and how their lab tests are done. So we have a very long way to go when it comes to understanding what we're getting, what we're taking, and what to expect out of these particular types of products. So a couple of retail news. I know some of you guys are retailers on this particular webinar. Walgreens, we might have seen that announcement, will be selling creams, sprays, patches containing CBD in 1,500 stores in Oregon, Colorado, New Mexico, Kentucky, Tennessee, Vermont, South Carolina, Illinois, and Indiana. That was followed by CVS's announcement as they will be selling CBD products in California, Colorado, Illinois, Indiana, Kentucky, Maryland, and Tennessee. So what can retailers do? Because, there's a lot of different things out here, right? Well, retailers should ask such questions as, where is the hemp grown? Whether it has been tested for any contaminants. How is it processed? Whether the manufacturer extracts the CBD on its own or purchases it from another company. And some of the top segments that we've been seeing in CBD: sleep, anxiety, and musculoskeletal. And when I talk about retail, I'm talking a lot about retail pharmacies. I have a near and dear special place for retail pharmacies in my heart when it comes to retail pharmacies. And, I know that's something that I would be more comfortable going to my retailer for, or especially for, than something else. However, and the reason I say that, not to offend any natural food stores or anything, but it's just so new. And I think until we get some more, rules around this particular issue, you'll start to see more of the natural food stores that you see locally will start to come and say, okay, we can now sell this product, and this is why we can sell it. But again, a lot of food has been the question, and that's just one point that I wanted to drive home in this particular webinar today. So we're reaching the end of our webinar today, and I just want to talk to you about maximizing your resources, because you've come on here to learn about what's happened, and you can see here from just the marketplace still developing, the regulatory oversight still developing, that there's a lot of potential holes and a lot of risk. And how can a business be able to function and then still have that peace of mind that what we're doing is good and our compliance is good? Well, we have a couple of tools that can help. First, just for speaking from Frier Levitt Government Affairs, we have a few capabilities. One, if you're looking at trying to change your state laws or talking to any policymakers or regulators within your particular states, we can definitely help you with comments to tell your regulators about what you're seeing and how rules should be changed. We can also help you with different state laws or provide clarification, or at least tell people about why your particular business needs to be included, and then again, give you a market through the legislation. So we can talk to you about different things like that. That's also on the state and federal level. It doesn't matter. So we can definitely help you with that. Also, there's white papers we can do. White papers are something that I know when things are new in the market, people do go out and try to tell policymakers about, if it's a particular product, technology that's going to impact the supply chain in a different way, and it comes with a lot of facts. So white papers are good. It's a really low-tech way of getting your viewpoints out there and educating policymakers about what's going on in your particular business as well. 50-state surveys are good. So if you're looking at trying to do things interstate when it comes to CBD, and let's say you're in California and you want to look at Oregon and Washington or Nevada, you want to ship out to those states, we can definitely give you some reports on what's going on out there, how the government is actually regulating or legislating this particular issue, and give you some strategy advice on what to do. And then if you're only looking at Texas or Ohio or Massachusetts, and you just want to know what's missing in my state, how can I make some of my state laws stronger, then we can do a particular gap analysis that would only be specific to that state. So you can definitely give us a call about that. And then if you do have legal questions, because there's this other side of me that is senior counsel, we can definitely handle that offline. Just let me know. But either one, I wanted to make sure that you had not only the issues and what was going on with the market. I didn't want to leave you guys with a problem without having a solution. And this is the solution that I did want to give to you. So with that, let me go ahead and finish by asking if there's any questions at this point. I will definitely take the questions, and hopefully we will show the contact slide. I'm not sure why it's not advancing. Does anyone, Katie, if anyone, I'm not really sure why this isn't advancing to the contact slide. Let me go ahead and give you my contact information just so you have it. You can always reach me by, there it is. You can reach me by email, rlanton@frierlevitt.com. That's the phone number to the firm, so you can always get me there. Here's our websites that you can go on, and then that's my title. So with that, I will see if there are any questions. Okay, one question that's just come in. Did I understand you to say that hemp oil is not considered a drug according to the FDA? Yes, you did, and that is correct. That is of right now. What I do want you to really pay attention to, again, is that public hearing on May 31st. And that's the reason why, that the oil seems to be fine. That doesn't really seem to be a problem. Again, it's just the edible products and making sure that you don't do anything with that right now with CBD, although the FDA is looking at trying to make sure that that can happen for you. But as of right now, that question is correct. I have another question from a compliance perspective. What are the most important questions to ask CBD suppliers before stocking their products at your retail store? Well, I think that's a very good question. And I think just going back to what I had said right at the end, so retailers should ask the following questions. If it's been tested for contaminants, how is your product processed? Whether the manufacturer extracts the CBD on its own or purchases it from another company, and really just understand what that particular manufacturer is. You know, what are they saying that their drug does? How do they test for uniformity? You want to make sure that you're at that 0.3 or less. So just from a compliance standpoint, that's what you want to do. So those are the suggestions that I would have. The next one, this is more of a clinical question. We get many patients in the retail setting asking about drug interactions with CBD. Is there a resource that you know of? Not off the top of my head. What I would suggest is maybe talking to the physicians. That's probably the best source that I can go to outside of a pharmacist. And saying, you know, a pharmacist actually would know definitely if there's any kind of drug interactions. That's probably the best place I would send you. But a physician is always another reliable, credible source that you can go to and ask for their particular medical advice. So those are the two places that I would definitely point you to. We have another question that's come in. It said, if we order from a company within our state, are we covered legally? That I'm not really sure about. I would have to know a little bit more about where you're writing from or where your operation is located and who else you're interacting with in order to give you a question. So for the person that asked that particular question, if you could just shoot me an email right at rlanton@frierlevitt.com, and I will definitely handle that offline. And I will see if there's any other questions coming in. We'll give it a couple of minutes. But these were good questions that have come in so far. Okay, I just found out where that previous question was. Okay. The one, this was, again, if we order from company within our state, are we covered legally? Yes, please send me an email. I do know where you're coming from. I won't disclose that. So again, just make sure that you send me an email and we can handle that offline. Any other questions? Okay, sounds like we have one more. That was the clinical question I'd answered earlier. Any more? Any new ones? Okay. Sounds like this might be the end of the questions. If you guys, here we go. Can a store selling CBD products use the term pharmacy? I'd have to know a little bit more about that particular question. So I'm assuming that you're not a pharmacy. Is that correct? Because if you're not a pharmacy, I would have some hesitation in calling yourself a pharmacy because you have to have a particular license in order to do that. But if I can't get any more specifics about that, I will definitely handle that question offline. It says they're not a pharmacy and they have no pharmacist. Yeah, I would have some real hesitation in saying that she would be a pharmacy. You'd have to. I mean, again, it would depend on the particular state that you're writing from, or you have your operations in, to take a look at what the particular Board of Pharmacy regulations are for what you can and can't have as far as calling yourself a pharmacy officially. But I would have some hesitation if you're not a pharmacy and have no pharmacist to call yourself a pharmacy. But again, we can take a look at that offline. Okay, we have another question coming in. How can a retail store position itself to go above and beyond compliance in 2019? Example, what is your best guess as to what the minimum requirements will be when the Farm Bill goes into effect? Well, the Farm Bill is already in effect. I just want to make that clear. So that went into effect in December of 2018. What we're just now waiting on now is the USDA regulations, and a lot of that really has to do with the growers, but there are some other CBD requirements for retailers just to take a look at. So again, my advice right now for how a store can position itself to go above and beyond compliance, I would just be very open about what you have. Again, make sure that you understand what your state allows you to do and what it allows you not to do. So, for example, like I said, in the state of Maine earlier in this presentation, they were talking about allowing for food when a lot of these people are not allowing for food. So that kind of is a head scratcher there. And again, really look at your localities and see what they've said. What does your city regulations say about CBD? And what can and can't you distribute or dispense in your particular locale? The only other thing, make sure that you know your supplier partners and what they're doing as well. I think at this point, that's probably the best that you can do. I would make sure that you really should have someone that's looking at any kind of compliance questions that you have internally, just to make sure again you've gone above and beyond. So whether that's a compliance officer, whether that's an attorney, either one of those I think would be uh, very good resources for you to have and pick their brains about what you could be doing better, because this is such a loosely regulated market right now that's soon to be regulated. So I think right now everything's okay, but starting in May, you're going to want to pay attention to the FDA. And again, if you don't have time to look at all that stuff, let us know. We definitely will help you do that, or at least give you some pointers on what to look for. But those are the suggestions that I would have as far as going above and beyond. Because again, this stuff is still being shaped, so there's really not something that I can concretely say you must do this, must do that. But again, just being aware of what your localities are allowing you to do is key. And again, knowing your suppliers and exactly what you want to sell and who you want to sell it to, and make sure that you keep your risk down. Any other questions? Okay, we have another question. Why are financial institutions, credit card companies, and credit card processing companies taking the position that they will not process CBD transactions? That is a very good question. Um, I think it's just the stigma that marijuana has had over the history of our country as far as commerce goes in marijuana. That's something you just want to stick far away from, and it's just really a lot of risk, for banks. They're like, oh well, if I start doing that, who are my clients going to be? Are these going to, are they going to be criminals? Are going to be this or that? I think the time now has modernized to where we are seeing a lot more legitimate benefits, from CBD. That's why DEA, FDA has put these different protocols about, percentage of THC evident in CBD oil. So I think that as time goes on, you'll start to see a lot of these financial institutions, credit card companies, start to soften their stance once they see more money is going into the market. They may start to do pilot programs, but this is definitely something that's going to have to involve some congressional oversight. Because again, if a bank starts, you just don't want someone from Congress saying, well, why are they doing this? And for them not to be educated. So you're definitely going to want to talk to the financial committees in Congress, the Senate, and the House, if you're trying to push that particular piece of legislation through, or at least that idea to change. But that's just kind of my take on why some of these credit card companies and so forth have been the way that they are. Okay, I got another question. We are a pharmaceutical supply wholesaler. We have independent pharmacy owners who want to sell CBD but are afraid to. Should they be afraid? No, I don't think they should be afraid at all. Again, it just depends on exactly what they want to sell and what their states say. And as long as they're compliant with that stuff, they should be fine. I can understand exactly why you would be afraid. Like I said, DEA, they've taken this conflicting stance. They come in and they say, yeah, it's technically illegal, but we're really going to let you get away with it because it's states and we're focused on larger stuff. And then you got the FDA that's pretty much made it clear right now about what they think is right and wrong. But now they have to have the ability to be kind of the sole regulating overseer. So I think that if you know these kinds of things, you should be fine. It just depends on exactly what you're trying to sell, where, if you're shipping it out of state, staying in state. So just knowing those things should be okay. And that's just a simple offline conversation about, it's just compliance. That's all this comes down to, but I don't think you should be afraid at all. Another question I've gotten, would health insurance cover for using marijuana or medicinal purposes such as pain? That's a good question. I think that it would depend on the particular payer, so I would just go through different payers, United Health, Humana, see, what do they feel about this? I think that as far as the overall market for coverage, it still might be a little bit early. This might be something you might have to get prior authorization for. But I definitely think the time is going to change, just like those credit cards that I was talking about. I definitely think it's going to be on the formulary at some point. It may be on the formulary of one of the payers. I don't know if there are any off the top of my head, but I would definitely check it out. Take a look and see what they say. Any other questions? I see we have 5 minutes left. All right, well, I see there are no more questions. If there's anyone that thinks of something offline after this webinar, please do not hesitate to give me a call or shoot me an email, and I will gladly answer what I can. So thank you so much for attending today. Hopefully we demystified CBD for you. And again, if we have any other questions, we will be more than happy to address those offline. Thank you so much.